Well, we often hear that giving blood saves lives, and perhaps that has never been more true than right now. As Indiana battles COVID-19, Versiti Blood Center of Indiana, formerly the Indiana Blood Center, is now collecting plasma from Hoosiers who have recovered from COVID-19 to treat patients currently battling the disease. Business of Health reporter Kylie Veleta has more. Kylie.
Thank you, Gary. Very important story. The FDA approved this emergency investigational treatment just days ago. As the 5th largest blood provider in the U.S., Versiti is leading the charge to get what's called convalescent plasma to the most critically ill COVID-19 patients. Joining me via Skype to tell us more about this blood treatment and Hoosiers' role in the effort is Dr. Dan Waxman, Vice President of Transfusion Medicine for Versiti Blood Centers. Dr. Waxman, thanks so much for joining me on the show.
Thanks for having me.
This is a really important topic, something happening right here on a local level to really help COVID-19 patients. Can you give us a quick medical explanation of how this blood treatment works?
So the way it works is we find individuals who have recovered from COVID-19. So these are people who were infected, people who have a test that shows that they were positive, and now at least 28 days post-resolution of symptoms, and we mean no fever, no cough, and at that time, we then can have them come in and be a plasma donor.
And so this is being done across the U.S. We have the first Indiana patient donating this week. What kind of promise is this treatment showing?
Well, we're hoping that there is going to be great promise. Basically, these individuals who recovered have antibodies in their bloodstream. And so when we collect their plasma, these antibodies that fought off their infection when they had it are now able to take them. And when we transfuse a patient with active illness, that way these antibodies are pre-made by the first donor, and then they're going to be in the patient and hopefully fight off the infection and have them have a much better clinical course.
Okay, and can you talk just a little bit about this challenge of timing that really hinges on patients having to wait 28 days after their symptoms go away? It's not the onset of symptoms. So we're hearing Indiana is in a surge right now. So can we do this in time?
Well, and that's the thing is we need people to have resolved their infection. Now, if they are 14 to 27 days post-resolution of symptoms, and we can get a second test taken and show they're negative, we can take them earlier. But I think as we see more people who've had this and resolved, and we get to that 28-day mark, we really can start bringing in people and have them donate. We just had our first donor this week, and we really need many more to start building an inventory of plasma products. Now, each donation can be made into several different products. Donors, based on their size, can donate between 400 milliliters to 800 milliliters. Then we make these into 200 milliliter units, and then each patient who gets treated will either receive 1 or 2 of those units. And so one donor can treat at least anywhere from 1 to maybe 2 or more patients.
And we had Versiti on the show in 2019 when you rebranded from Indiana Blood Center to become this bigger entity that now spans 5 states. So now being that bigger, stronger presence as Versiti, did that help your organization be able to respond to this crisis in such a big way?
Absolutely, because I've been leading a task force that covers our 5 states for this. And so I have other physicians, I have our technical staff, I have our quality staff, and really they could all get together and say, okay, how are we going to go about doing this? What do we need to create these products and bring these donors in and draw them? And so it really has helped us. So just this week, we're collecting donors in Wisconsin, Indiana, Michigan. We're actually going to be collecting our donors in Ohio and soon Illinois. So it really is something that the states together are able to work together, our centers, our staff, and we have an incredible staff, and we're all in here working together.
And you mentioned earlier that, we often look to pharmaceutical companies just by reflex for a solution, but really this is something that we can do here locally, and the public plays a big role in this.
Absolutely. This is something just like our everyday need for blood donors, and we still have that ongoing, where one blood donor can save up to 3 lives. Well, here's a situation where we have people who've recovered from an illness, and now they can donate a product that is made into a therapeutic agent. And so this is something that we can do on a local level. And so we really want people to contact us. You will have what they either can call or email us, and we can screen them and see if they can come in and be a donor.
Yes, we have some graphics that show the number that folks should call, as well as an email address. So I know you're really trying to get the word out there for folks to get in touch with Versiti if they've had COVID and recovered. One other question about the donations that come in Indiana. Do they stay in Indiana, or can they go elsewhere where they're most needed?
Good question. So right now they're going to stay in Indiana because we have patients right here in Indiana who need these products, and these patients are at a variety of different hospitals in Indiana. As we start to build an inventory, then we can share between our parts of Versiti. But right now, the donations that we're going to be collecting, we're going to be treating patients right here locally.
All right, very interesting. I know you can't see them, Dr. Waxman, but we were putting up the graphics of the number in the email, so we're helping to get the word out there. Thanks again for being on the show today.
Thanks for having me on. I really appreciate it.
All right, Gary, back to you.